thanks for joining us. I'm Heather. I'm the board chair for CureGRIN, and I'm also Maximilian's mom. Max has a GRI of 4 variant, originally from Canada, but I've spent the last 10 years living in Germany with my husband and 3 kids. So this is a really exciting time to be part of CureGRIN and being involved with the board. As our first 3-year board terms are ending, we really want to take a moment right now and thank our past and outgoing board members. So Mary Beth, Lauren, Yuki, Clara, and Paul, by volunteering your time, your talent, your leadership, you've helped make CureGRIN into the amazing organization that it is. So thank you so much for all that you've done. I'm also really excited to introduce our incoming board members who are going to be joining us starting in May. It's really important that our board reflects our global community, also the range of genes. So Caitlin, Federica, Tina, Natasha, Robert, and Paulo, thank you for volunteering to serve the global GRI community. And we're delighted to have you join myself, Jillian Hastings Ward, as well as Keith and Denise on the board going forward. So who loves finance and accounting or knows someone who likes finance and accounting? We're looking for a treasurer to join the board, and this role does not have to be a GRI family member. So if you have a friend, relative, somebody in your network who lives in the US with some accounting and finance experience who might be interested in volunteering as our board treasurer, please reach out and let me know. That would be fantastic. And then next, one of the things that we've just started working or completed is the strategic planning process. And so I wanted to share with everyone at a high level what our strategic goals are. So first, to drive the research agenda and find treatments and cures. Secondly, unite and empower the global GRI community. And finally, strengthen our operations, governance, and revenue in order to achieve our mission. And you'll be hearing more about this throughout the presentation. Just from a personal perspective, I continue to be really amazed by all that CureGRIN has accomplished for the GRI community in such a short period of time. I'd really like to thank Denise and Keith and Lauren and Megan for all that they do and all that they'll continue to do in order to help us. It's important to remember that CureGRIN started as a volunteer organization, and they have been making and continue to make a transition into having paid staff. And strategically, this is something that is incredibly important in order to make sure CureGRIN remains a sustainable organization. It definitely takes a dedicated team and deep expertise to keep us moving towards our ambitious goals. And with that, I'll turn it over to Keith.
Thanks, Heather. So Heather mentioned the staff, and so I'll just take a moment to introduce everybody. They're going to be speaking today as well. But I'm the continuing on as CEO, but with a change in that for the first time I'll be working as a full-time contract employee as of CureGRIN. So this is the first time we've had someone working full-time for the organization. Denise Rehner, our president, is going to continue to work about half-time for us, and she's really going to be focusing on the revenue side and helping us to get grants and sponsorships and work with families and others to help with fundraising. Megan, who's been with us for a couple of years now as our research coordinator and is doing a terrific job. Megan's also currently doing an MD PhD program. So she's busy, but always has lots of time for us. So thank you, Megan. And Heather mentioned that Lauren is leaving the board, but she's not leaving CureGRIN. So we're really excited that as of, well, she's already sort of filling in the role, but as of May 1st, she's officially going to be our community coordinator. This is a new position, and really excited about what she's already bringing to the organization. But CureGRIN isn't us. CureGRIN is all of you. You are all CureGRIN, and CureGRIN is your organization. And so here are some of the things that we're hoping to do today for you, because this is your organization. So we want you to meet the team, talk about our mission and values. We're going to tell you how we've raised and spent money over our first 3 years, our budget and goals for this upcoming year, which starts on May 1st, how we're putting the research roadmap into action, our fundraising plans, and then we're going to try to make sure we have time at the end for your questions. I thought it was important also at the start to share our mission. So as part of our strategic planning, we've revisited our mission. And so CureGRIN is dedicated to improving the lives of people around the world with GRI disorder and their families through research, education, and connectivity. We work closely with scientists and the medical community to drive patient-centered research that will lead to treatments and cures. I also wanted to share our values. So integrity. We are getting donations from families that are going out and asking their families and friends to donate. So it's really important to us that we maintain the highest standards of transparency and fiscal responsibility. And that's part of why we want to share how we're spending our money and our plans today. Collaboration. We work closely with researchers around the world. And we also have great relationships with the other GRI organizations and family groups. And we promote collaboration and openness between researchers, and actually really grateful that in general, our research community for GRI also believes in this. And they're, for the most part, really open to sharing research before it's published and just working together to try and get to treatments and cures. And then that feeds into optimism as one of our values. We believe that treatments and cures are coming that will make a significant difference in the life of people with GRI disorders. So with that, I'm going to turn it over to Denise Rehner, who's going to talk about how we have earned and spent our money over the first 3 years of operations.
Sorry, I had to unmute myself. Thank you, Keith. So I wanted to remind everybody the incredible grant that we received from CZI just over 2.5 years ago when we were first launching. And it truly is the reason why we are here today and able to put together such an incredible and robust educational program, and really to be able to expand our research network to the level that it is today. So for the first 2 years, we received a grant of $465,000, and we recently were allotted a third-year funding for an additional $150,000. And if you remember, this grant is a restricted grant, and the purpose of the grant is to build our capacity. And so for the last 2.5 years, CureGRIN has really leveraged some incredible tools and training and mentorships throughout the Rare as One program that really has allowed us to be where we are today. And so I wanted to share what this grant has allowed us to do, and essentially where the money has gone. So we have essentially expanded our collaborative research network, many of them who you heard of the last couple of days, to hundreds of researchers within our community. We have, as Heather mentioned, dedicated staff, and we've been able to secure science advisors with this fund that has allowed us to create the research roadmap, and also to continue to engage and educate this GRI community. We have been able to leverage staff and board development and training, and the strategic plan that we'll be sharing later today. So the first 2 years, you'll see the breakdown of what we spent on staff and science advisors. These educational conferences, you should know that we do have prepaid allocated funds for the next conference in Boston next year, which you'll hear more about, as well as allowing us to launch the GRI Connect online forum, funding towards our digital marketing program, our staff and strategic planning development, and general overhead, and a grant development program that you'll hear more about as well. And with the third-year funding, you'll see what the percentages is allocated here to staff, to the same categories, but we've also allocated some funding towards, fingers crossed, we'll be able to travel and meet with biotech companies and researchers in the future. Of course, pending COVID outcome, as well as some sponsorships of medical conferences where we'll be able to continue to expand our research network. Next slide. And this is a breakdown of the revenue that we received to date. You'll see the first year, our fiscal year starts May 1st and ends April 30th. This year we'll be wrapping up here in the next week or so. So you'll see the total revenue. The first year, with a huge amount of that was the CZI grant, which we recognize in the first year because we're using a not cash, but accrual basis accounting. So you'll see on the bottom line is what we've been able to raise with the help of our amazing family fundraisers and community, the individual donations. First year, 165,000, second year, over 200,000, and our anticipated wrap up of this year of 273,000-ish. So total revenue from the individual donations from our family fundraisers and campaigns are 661,000. And what I think is really incredible is over 60% of that revenue came from just 20 families. And that's truly remarkable. 83% came from the top 66 families of fundraisers. You'll also note that we have essentially somewhere between 400 and 500 families in our network that we know of. And just imagine what we could accomplish if we had more families that were able to participate in our ongoing campaigns. Here on the last line, you'll see our goal for next year. Go back one more, sorry. Just one more point. Our goal is really to diversify our revenue. We've been able to essentially pay all of our overhead costs from the CZI grant, which is up this year. And so our goal is really to diversify and to continue to look for other areas of other sources of revenue, including grants and sponsorships.
Okay, so Heather already shared information on our strategic goals, and I'm going to get into them a little bit in a little bit more detail. But first, just wanted to mention the process that we've gone on as part of this. So again, through our CZI funds, we've been able to work with Calliope Glaros and her team at Philanthropy Without Borders. So it's the same team that's helping us today to put on this conference. And they put together a great process of working with our entire board and looking at other organizations to really see what we need to do to continue to grow and develop the organization. So I'm going to get into each of these three that Heather already mentioned in just a little bit more detail. So the first one is to drive the research agenda to find treatments and cures by the end of the decade. So for each of these, we have a vision and then strategies that we're going to pursue. So the vision is basically that the research roadmap that we developed last year, that by the end of this, we're going to have answers, or at least partial answers, to the 10 essential questions. And I'm going to talk more about the research roadmap later in this presentation. And how we're doing that in terms of strategies. So there's different ways. We're planning to invest up to $900,000 in this next fiscal year, which starts on May 1st. And we do that through, a big part of that is through these GRIN funded proposals. So this first line, but we are also involved in other ways too. So separately from the 900,000, we have GRI related, one GRI related charity at the University of Toronto. So we have a GRI research fund there that's helping to fund some of the work. And largely that is donors in Canada that are donating there so that they can get local tax receipts. Something we're thinking about doing in other countries too. And then the third way is to help researchers secure funding from external sources. And in a little bit, Megan is going to talk about a great example of that. The second is to unite and empower the global GRI community. So this is something that's really important to us, is that we act and are seen to be a global organization. Although we're based in the US, right from the start, we wanted to be global by design and have people representing different countries. And this was something, as Heather mentioned, that we were really focused on when we were seeking applications and interviewing for new board members. And so how do we do that? And I guess the other part that's important here is that it's all GRI genes. So although we were founded by people whose children all had GRIN 1, from the outset, we wanted to represent all GRI genes. And then last year we made the decision to expand, all GRIN genes. And then last year we made the decision to expand into all GRI genes. So GRIA and GRIC as well. And we're there for GRID patients if and when they find us. In terms of our strategies to achieve this, so we're looking to increase our global representation kind of throughout the organization, and the board and new members of the Scientific and Medical Advisory Board are good examples of that. Launch our Global Ambassador Program. This is something that Lauren's going to talk a little bit more about when she presents later. And also to invest in virtual and in-person events and platforms to grow our global network. So this kind of event that we're holding this weekend is one example. GRI Connect, which again, Lauren is going to talk about, is another example. And then the third pillar of our focus is to strengthen our operations, our governance and revenue in order to achieve our mission. So we want to have a robust and global team and stable revenue from a variety of sources. So one of the, I guess, hazards or risks that we really identified when we did our strategic plan was, as Denise mentioned, we've been so dependent on funding from this one source from CZI. And beyond that, we'd really been relying primarily on families to do the fundraising. So starting this year, we still need a lot of help from families, but we're also broadening it with a real program to go after other grants and sponsorships. And that's a big part of why Denise is going to be just focusing on the revenue side in the future. And how our strategies to grow and strengthen our board of directors. So I feel like we've done a good job of that through the new board members that are joining, and really excited about that. Strengthen our operations team through strategic staffing and volunteer support. So we're really grateful to the board for making the decision to invest in the staffing so we could add a new position, and I could spend more of my time working for CureGRIN, and then diversify our revenue, as I've already mentioned. So Denise, I think we crossed wires here. We both prepared slides about our budget for this coming year, but this one, we also have the percentage. So you can see the $1.3 million in total that the board has approved for fiscal year 2023, which runs starting May 1st through the following April 30th. We have a big amount of money to spend on research investments. And this is what we're planning to spend this coming year is a lot more than what we're planning to raise in the coming year. And this is because we've been strategically cautious about how we invested research funds, because we wanted to really make sure that we had the strategy right first. We know that so many of you work so hard and get your family and friends to donate, that we wanted to work through first the process for making sure that every dollar that is donated goes as far as possible. And that's why we developed the research roadmap. And that's why we spent a lot of time since developing the research roadmap to break down for each of those 10 questions exactly how we're going to answer them. And we're at a place now where we have that figured out. And I'm going to go into that a little more in the future. I'm just trying to think if there's anything I wanted else to highlight here, but I don't think so. So I'm going to hand it over now to Lauren Williams, who's our community coordinator.
Hi guys. Okay, first let me say before you move to the next slide how excited I am to come to you as CureGRIN's community coordinator. I'm very excited to have this position and it fulfills me. So thank you guys so much for letting me take part in such an amazing organization. So let's go to the next slide. I just wanted to point out that we have a plethora of resources available to each of you. I'm going to start with some of the things that we do offer. If you go to our website, www.curegrin.org, there's tons of things on the website available to you. We have all of our blog posts, different stories from all of our families. If you'd like to submit a story, it's available there as well. You can sign up for our scientific newsletter and our daily general newsletter, as well as see some of the research papers and news throughout the GRI community. Another thing that we have available to you is CureGRIN's YouTube channel. On this YouTube channel, we have a ton of past events and webinars currently translated into a variety of different languages. If there's anything that you'd like translated that you see that we do not have, you can reach out to us and I'm happy to help you. Another great resource is, of course, our social media platforms. That way you can stay updated with everything related to GRI. And as Keith mentioned earlier, we have a wonderful platform called GRI Connect, if you want to go to the next slide. GRI Connect is basically a one-stop shop for all GRI families. And so our purpose here is to make sure we have clinicians, researchers, and families all have a safe space to be able to connect with each other. There's a ton of different forums available. If there's a forum that you would like set up, a particular forum we don't have, you can request that and we can set that up for you. We have different groups you could be available to, such as multiple languages. We have groups by GRI variant. Again, if you log on to see some of this information and your variant is not available, you can reach out and we are happy to build that group for you. So we're really hoping to get this set up as one place to house all of our resources and a great place for everybody to connect with each other. So you can move to the next slide. And I don't have much to give you other than Keith's one-liner that he gave you earlier for the ambassador program. But we're basically establishing this to build relationships within different states and different communities, different countries, to increase awareness and support for GRI families. And so right now, we're in the process of putting together some applications and what this is going to look like, but we're hoping to have that out soon. But that way, whoever applies to be a part of this ambassador program is basically going to serve as the liaison between CureGRIN and their locality. I'm really excited to be able to get more information to you guys. I think this is going to be great for the GRI community. And I'm open to any questions when this is over at the end of the session. Thanks, guys.
Hi, everyone. My name is Megan Collins, and I am the research coordinator for CureGRIN. Keith already told you a little bit about me, but this is my second year with the organization, and we've come a long way since we started, from building the research roadmap, building out our research contacts and clinician contacts. So I'm very excited to share a little bit of some updates with you today. Keith, if you want to go to the next slide. So I wanted to first talk about our GRI Genes Research Roundtable. So our goal for our roundtable is to promote collaboration between researchers, clinicians, and families so that we can accelerate a path to cure and treatments for GRI disorders. We bring together researchers and clinicians who study the gamut of GRI disorders, so the GRIN genes, GRIA genes, GRIP genes, NMDA receptors, and the AMPA receptors, kainate receptors, and delta receptors. And the purpose of these is to discuss and exchange ideas openly. Keith talked a little bit about how we try to promote open science, where people will discuss papers, people will discuss unpublished research, anything that is new and exciting in the field. And we also try to draw from more tangential ideas, whether it's something that's been studied in another disorder but not in GRI, or if it's something specific to the receptor but isn't, you know, well known within the GRI community. So those are things that we try to bring to our GRI Genes Research Roundtables. And our very first meeting was actually held in September 2020, and since then we've had 13 GRI Genes Roundtable meetings. Typically our average attendance varies from anywhere from 30 researchers and clinicians to 50 plus, and we've had over 15 countries represented. And through those, we have people who are literally presenting at 2 a.m. in the morning their time, or 5 a.m. in the morning their time, and we really greatly appreciate their time and dedication to being able to come out and have these discussions even at very late or early hours, depending on where they are, anywhere from New Zealand to Japan and elsewhere. And at these meetings, we also have our families share a family story, which is really important and valuable to the researchers and the clinicians. A lot of times we learn about different things related to symptomology that we didn't know beforehand. Also, it provides more context, especially for more of the bench science researchers to know what they're working towards and the value of their work. Researchers also share updates at these meetings. And like I said, we have very open discussions, allowing feedback from different parties to be able to share their ideas and to communicate openly. And so we encourage you to invite your child's clinicians to join our GRI Genes Research Roundtable meetings, and also join us on GRI Connect. If they're not already connected to us, you can have them email me, or you can connect us together. My email is megan@curegrin.org. Also, if you would like to share your family story, you can feel free to reach out to me by email, and we'd be happy to have you present at a future roundtable meeting. Also, for the researchers who are on the call, if you would like to present at a future meeting, we would love to have you there as well, and get you added to the mailing list and to GRI Connect if you haven't been onboarded there already. And our next research roundtable meeting is actually scheduled for June 2nd. So we have it coming up in a couple months here. You can go to the next slide. And so another thing I wanted to discuss today is really how CureGRIN works to drive research. So we do this through building, synergistic partnerships between public and private entities. And so this can include academic researchers, clinical researchers, and industry. And one example that we wanted to talk about today was through Dr. Amy Ramsey, Dr. Collingridge, Dr. Angels Garcia Cazorla, and Homology Medicine. So in 2019, Keith actually went to Homology Medicines in Boston and met with some of the researchers there, and some of the other people in the industry there. And Homology actually agreed to make a gene therapy medicine for GRIN disorders and to test them in GRIN animal models. So last year, Keith actually learned about the grant opportunity that was being offered through Simons and brought this forward to Dr. Albert Seymour, who's the Chief Scientific Officer of, over at Homology, and encouraged him and Dr. Amy Ramsey to apply. And through that process, there were some hiccups, there were some delays with life happening. And so we encouraged everybody to come together, and we facilitated meetings and brought that process together so that way we could bridge those partnerships. And the application was successful. They were actually awarded $1.1 million for the Simons Foundation Autism Research Initiative Genomics of Autism Spectrum Disorder Pathways to Genetic Therapies grant. And that's actually underway now. Dr. Ramsey talked a little bit about it, or Dr. Ramsey's student, Phoebe, talked a little bit about it yesterday. And basically what the researchers are doing is they're working to study the effects of gene therapy medicines in GRIN1 loss of function variants, GRIN1 gain of function variant, and GRIN2B loss of function. And so they're going to try different methods to help, which are going to help answer some of our questions for our research roadmap that Keith's going to talk a little bit about. But from this study, we're going to learn more about intravenous and intrathecal routes of administration. We're going to learn more about seeing if the mice have any harm or toxicity from the treatment. And we'll also see how long these benefits last. And the project's going to be funded over a period of 3 years. And it's just really exciting that as an organization, we're able to partner with these researchers and with companies at large to be able to forge a path forward and answer some of these really important questions to help find treatments and cures for your kids. So thank you so much.
Thank you. Thank you, Lauren and Megan. So yeah, now I'm going to talk more about our research roadmap. And I'm going to go over kind of the background quickly, but if you haven't seen it, I encourage you to take a look at the document itself. And there's also a YouTube video on our YouTube channel where we presented what we were doing in the roadmap in detail about a year ago. But basically, what our goal in identifying and developing a research roadmap was to identify and prioritize the questions that needed to be answered in order to find cures and treatments for GRI disorder. And this was partly to define how CureGRIN invests the money that we raise, and also to influence the priorities of researchers, biotech, and other GRIN advocacy organizations. Actually, I'm just going to skip that slide because of timing, but basically our roadmap involved consulting with families and researchers through surveys and working groups and focus groups. And essentially, we got to a place where we presented this a year ago to the GRI community. And the purple now is what we've been working on over the last few months, which is to identify the best path to answer each question. And we're about to move into step 9, which is to follow the chosen path to answer the questions. Two of the key things that we learned through this process from families was one, that families want a cure, but they also really want us to focus on treatments. So things that can help with epilepsy or neurostorms or sleep, all of these issues that are important to families. So if treatments can come sooner, that's definitely something that's important for families. And we also learned what the priorities were for families. And this is what guides us throughout the research roadmap process. We asked everyone the symptoms that their children had, but then we also asked if we could only focus on one of these, what would be the single most important for you, for us to try to work with researchers and nudge researchers to finding treatments and cures for. And the 3 that they identified were intellectual disability and communication, epilepsy and seizures, and mood behavior and neurostorms. I'm going to skip that slide 2 and just get into the 10 essential questions that came out of that process. We'll get into those in more detail. So step 8 that I mentioned was to identify the best path to answer each question. So in order to do that, we worked with researchers at Combined Brain. So this is an organization that CureGRIN is part of that represents a number of different patient advocacy groups for people who are have neurodevelopmental disorders. So we worked with Combined Brain. We also worked with 3 of our key researchers. So Dr. Steve Sharon-Ellis, Dr. Tim Benke, and Dr. Amy Ramsey, and talked through many, many meetings, talked through what the best way would be to answer the different questions. And then Combined Brain kind of distilled all that information for us and broke things down into 4 different buckets of where we can help drive things. So one is collaboration, so bringing people together. One is providing funding grants to actually hire researchers to do things. One is through educational opportunities. Sometimes this is for researchers, sometimes this is for parents. And then finally, just through our access to patients, there's a lot that you can do to help us move things along. So the first one was around outcome measures. So if you were at the session yesterday, you know that outcome measures are how we measure symptoms and can tell if a treatment is helping. So there's way too much on here for me to be able to go into all of them. So I'm going to try and just highlight the ones that have yellow stars here. So the first one is around PSH. So this is commonly called neurostorms, but the PSH stands for parasympathetic, paroxysmal sympathetic hyperactivity. And so this is something that, we're really realizing is more and more, we're realizing how this is a significant issue for our community. And so this is something important that if there are treatments and cures, we want to drive getting those to patients. And so in order to do that, we have to figure out, how do we identify the outcome measures? How do we tell if a medicine is actually helping with PSH? The next one is around biomarkers. So these are signs in blood or urine or brain waves that can help us see if a patient is potentially has GRIN without a genetics test. But perhaps more importantly, these biomarkers could also tell us right away if a treatment is working. So, so for something like speech or motor abilities, that could take, or just intellectual cognition, those kinds of improvements could take months to measure. But looking at biomarkers, you might see that the biology underlying those symptoms is changing sooner. So the one that we've highlighted here are around EEGs. So, well, the first one's around EEG. So trying to pull together all of the family EEGs by partnering with researchers and creating an EEG biorepository. And I'm mindful of the time, and I know that we're hoping to give you time for questions too. So a really important question, I think, for a lot of families is a cure possible at any age? So a lot of you have heard of Amy Ramsey's work on the GRIN 1 mouse that was developed, where they were able to basically build a mouse with a sort of GRIN 1 on-off switch. And so the mouse grew up as if it had GRIN 1, and then when the mouse was an adolescent or an adult, they flipped the switch, and the mouse's brain kind of went back to what typical mice were like, and then the behaviors also went back to what typical mice were like. So this is considered, a partial rescue or a partial cure of these mice. Now, you can use the same approach on humans, but there's a number of other things that are about to be tested. But to see if the most important thing is that it showed that potentially GRIs could be rescued at any age. So we've done this for GRIN 1. We'd like to see about invest in doing that for other genes as well. So some of the other GRINs and GRIAs and GRICs. The best delivery route for gene therapy. So just doing it through intravenous, directly into the blood. That's the least invasive way. Having to do it through a spinal tap obviously is more invasive, and having to inject, drill a hole into the brain and inject that way would be the most invasive. So, but we're exploring all of these routes to do this. So one of the things that is related to this is seed funding for studies to explore stem cell gene therapy. And this is something actually we can already put a check mark beside, because the board of directors at CureGRIN made a decision to invest in this early when we had the opportunity. And this is what Dr. Joe Anderson talked about yesterday. And we're funding that to move forward. Deliver gene therapies for larger genes. This is actually something that when we came up with the questions a year ago, we thought it was a big deal. The more research we've done, we believe that delivering the GRIN2 genes may be less of a hurdle for gene therapies than we originally thought. But there are also other ways that we're exploring if those don't work. Optimal drugs targeting kainate receptors. So if you attended the sessions earlier today, you heard about ampakines. And so we're looking to collaborate to see if those can help with GRIA patients. I think it's promising for many of them, but could potentially also help with other GRIA patients as well. Okay, I'm going to jump forward and not get into everything here just because of timing. But I will say, jump forward to this last one, which is around phenotyping of the different variants. One of the things that we're planning to invest some funding in that directly relates to families is to collect more blood samples so that we can store blood cells and develop iPSCs for different patients. So GRIN 2B Foundation has done this for a few GRIN 2B patients through Simons. And so we're hoping to do more of this so we can have a robust sample for researchers from a number of different genes. And then there's different experiments that we'd want to do with that. So we've set up the GRI Research Accelerator Fund, and we're just in the process now of finalizing an RFP that we're going to be launching over the next few weeks. And through the RFP, so when I add up everything that's on these slides that I talked about and all the things I didn't talk about, we estimate that that it would take between $1.5 million and $2.5 million to answer these questions. There are more recommendations that Combined Brain and the researchers identified that would cost, sorry, this should, now I'm confused. I don't know what I wrote here, but sorry, there's another $1 to $2 million beyond which, I just wrote this wrong. There's another $1 to $2 million in recommendations that weren't included there. Now the board has approved funding of up to $900,000 in funding this year, but this is all kind of contingent on where our revenue's at. And we're not, unfortunately, we haven't finished the year as strongly as we thought. Our revenue target for the year from families was originally about $350,000. I think we've had to scale that back. So between, I guess, over the next 7 or 8 days, when we close the year, anything that we raise is going directly into the Accelerator Fund. So it's really a good opportunity to help us get to treatments and cures faster. And so now I'm going to turn it over to Denise to talk a little bit more about how we'll achieve our revenue targets.
I, again, wanted to just thank our incredible family fundraisers and supporters. You know, we created this fun levels of really recognizing all the hard work that our families have done. We've had a couple of families that have raised over $50,000. Heather Cartwright being one of them, and then Natasha Lasmana, both board members, incredible. Over $50,000, and you can see the different categories: $20,000, $10,000, $5,000, $2,500, $1,000, and everything adds up. And it all helps us to be able to invest these dollars into the research that's needed to find treatments and cures. And again, this is over the last 2.5 years of total fundraising. So again, thank you to all of the families that reach out to your families and neighbors and friends and ask for support and share our hope for a cure. And again, wanted to thank our generous sponsors. Many of them have sponsored this event, including GRIN Therapeutics, Sage, Variant, and I think we're missing one from here, but Homology recently sponsored our GRI University series, which was incredible. And Portia, you'll hear more about them, but they're sponsoring an upcoming event that we have as well. So thank you to all of our incredible supporters. And the next slide shows a few of our campaigns that are coming up throughout the year. We have our 3rd annual Get Moving for GRIN. It's a virtual event in July. And you can participate by signing up and doing either a half, full, or if you're a overachiever, ultra marathon in a month. And we'll share more details about that. Our annual Count Me In campaign is in November, all November, followed by Giving Tuesday on the 29th. And then we have year-round campaigns that you can participate in at any time. We do have a peer-to-peer online setup that you can participate anytime that we call Count Me. We'll change it to In, Count Me In 365. The Facebook fundraisers, are the easiest to set up and share on your social media, and they also take there's no fee involved, so all of that revenue comes directly to us. Amazon Smile, we always, we're getting to really see an increase in people that are participating in Amazon Smile. A portion of what you purchase in the US, and I believe also in the UK now, comes to us, and we've been seeing an increase in that, which is incredible, because you're already it doesn't cost you anything. It's really easy to do. And then I think the next slides we show we're going to talk about our fundraising goal for the next 3 years. So this next year coming up, starting May 1st, from individual donations, our goal is to raise $360,000. I mentioned previously, we want to diversify our revenue. So we're really targeting our sponsorships and grants. And you'll see over the next 3 years, the increase in each category. For the following year, 432 from individual donations and up to 518 for the following year. Again, I just wanted to highlight that it was a handful of 20 families that raised over 60% of our total revenue over the last 3 years, which is truly incredible. And we can all participate in this at some level. And I think the next slide is about our upcoming Get Moving for GRI campaign. So this year, this will be the first year that we're offering t-shirts with the registration. And so I actually have a sample here of this really, can you see this? Can you see? Okay. So this is our Get Moving for GRI t-shirt. And on the back will be all of our sponsors' logo. We already secured Porsche here in Colorado Springs for a sponsorship. This year, we'll also have personalized yard signs that you can insert your kiddo's picture and name on the yard side. That's a yard sign that's available for an additional purchase. But to let your neighbors know what you're participating in, we can even insert your direct link to your fundraising page. The overall goal for this event is $50,000. That's not including the sponsorship funds. But on the next slide, I want to share with you a promotion that we're doing right now. We have sponsorship. We have a sponsorship package that we can provide. There's a link to it there on the this CureGRIN.org/sponsorships. We have a category for families that if you want to sponsor the event, you will get your name on the t-shirt, which will be really cool. Family sponsorship for $250. But we're offering a promotion right now. If you book your promotion if you book your sponsorship by the 30th, the last day of this month, you'll receive 2 entrances for the event itself. They're $40 each, so it's a $80 savings. If you want to commit a pledge, Lauren just shared the link in the chat box. So there's a pledge box where you can pledge that you want to sponsor and sign up to sponsor, but you could pay by the 15th of next month and you'll receive 1 free entrance, a $40 savings. So it'll be really cool to have your family's name or team name printed on the t-shirt that you'll have for years. Okay, and I think the next slide. So yesterday we gave away a suite for a grand prize for the past year's campaigns, and we'll be giving away another one for the conference in Boston next year in March. So if you reach a goal of 2,500, you'll get one entry into the raffle, and then for every 500 over 2,500, you'll get an extra entry. So that's how so many families were able to earn so many entries into the raffle yesterday. And next slide, I think it's just a reminder to save the date for the conference in Boston. We're going to do it this year. I feel it. It's going to happen March 23rd to the 26th. And we will be sending out there's a link where you can reserve a hotel room. We hope to have that hopefully next week. We're just finalizing those updated contracts with the hotel. And the next slide, I think, is just a reminder of how you can help us achieve our plan. Submitting your child's data to the registries, creating your fundraiser, save the date for the conference. We'll have to update that with the new dates for next year. Signing up to volunteer and staying connected with us on our social media. And then I think the next slide is just a kind of a nice summary of what we've been able to accomplish in the last 2.5 years. We're serving over 300 families. We've raised over $1.3 million. We've reached over 30 families in our community, over 500 dedicated donors, hundreds of hours of educational events such as this in 8 different languages. We have over 1,900 supporters. So far, we've issued 85,000 in grants, one to the CFIRB for functional analysis, and one to was the University of Davis.
Joe Anderson.
Yep. And we'll be distributing, like Keith mentioned, 900,000 in grants in this next upcoming fiscal year. We've had, I believe, about 12 research roundtables over the last few years, increased our research network to over 100 researchers. And you've heard about the grant for University of Toronto, and that Keith was involved in helping to secure that grant. That's a quote from Steve Trineas about the impact that our grant had for him on the functional analysis, and 2 partnerships with industry and preclinical and clinical trials. Keith, did you want to add anything to that? You're on mute.
No, nothing to add. I think I know Amy's on the call. I think we accidentally inflated the number there, but for the gene therapy trial, but I think it's about 1.1 or 1.2. But yeah, no, we've done a lot, and as you can see, we've only just really scratched the surface in terms of the research grants that we're giving away. So it's going to be a really big year, and more than ever, we're really hoping to get the support of families and really ramp up our work on sponsorships and grants.